Patients often come onto hospice with an abundance of medications and supplements, both prescription and over-the-counter. There is a myth that when a person comes onto hospice, they stop all your medications. This is not the case. Rather, what hospice does is focus on medications that best serve the patient and their overall comfort and well-being. We see patients with as many as 10 to 30 medications, and when a patient comes onto hospice, it's because their body is slowing, and the goal of hospice is to help develop a medication regimen that supports patients feeling the best they can at the end of their life. Some medications and supplements no longer make sense and are just a burden to the body. But we don't stop medications that add to comfort by supporting the disease process. And a good example of this is cardiac medications for a person with heart disease. We adjust these medications as things change. For example, as the blood pressure drops toward the end of life, which is expected, we adjust the blood pressure medications with the intent of having the optimal blood pressure in order to feel the best they can. An example of a medication that really isn't serving the body at end of life are medications designed to lower the cholesterol. When people have only months to live, taking these medications no longer serves a purpose, and they too are not without side effects. In fact, it's not uncommon when people come on to hospice and we discontinue or narrow down to essential medications, they feel quite a bit better with just that intervention. It is important to know that hospice only offers recommendations about your medications. Granted, the hospice team are the specialists at medications for end of life, but patients always have the right to say what medications they are willing to take or not willing to take. What's important is to have the conversations about medications so that there's a full understanding of the hospice recommendations. A person on hospice has two doctors, their primary or referring doctor to hospice, and the hospice doctor. In general, the hospice doctor is in charge of prescribing and managing medications regimen for the end of life. It is the standard of practice that hospice does a medication review of everything that they are taking and do an interaction review. The fact is that the more medications a person is taking, the higher chance there is of having potentially adverse interactions. Not just in hospice, but in general, medical practice is moving toward de-describing, which simply means reviewing medications and narrowing them down to what is most needed and effective for the best overall well-being. If you find these videos helpful, please subscribe and like to our YouTube site, ask questions, and you can get a copy of our Hospice Care Plan booklet on our website, the Hospice Care Plan. Nancy and I are happy to answer any questions, and people are finding this book really helpful, so get your copy today.